So to repeat back what I just heard from you, the case numbers are increasingly not helpful in understanding what the picture looks like on the ground. And even though the hospitalization numbers have gone up quite a bit, if you look closely, many of those patients are not presenting primarily for COVID. But there has been debate over whether we're making too much, doctor, of our patients with COVID. Are they there for COVID? Because ultimately, there are lots of hospital beds and hospital workers engaged in this fight.
Well, certainly the hospitalization data in that category of people with COVID is murky. Some of the patients are here because of a complication, let's say dehydration or kidney failure, because they had a COVID infection recently. I would, of course, consider those patients to be additive. In other words, COVID led them to go to the hospital. But for many of them, that's not the case. And so, more nuance when it comes to informing how we interpret hospitalization data is going to be really important. I would actually argue what has really strained hospitals and hospital systems throughout the Omicron wave, which is a very different dynamic than we've seen in earlier surges of COVID-19, has been the impact on staff. The fact is, our staffing shortage at the end of last month and the beginning of January, or 2 months ago, in the beginning of January, has been the number of employees who had to be out due to COVID or a COVID related reason because of the rules. Of course, many of our employees were out because they were sick. Of course, anybody who is sick or feeling ill or has a fever needs to be out. But the fact was that when the CDC reduced the time frame out of work required for healthcare workers from 10 days to 5 days, that may have been among the most helpful moves that the federal government made to allow us to withstand this surge. The fact is, we had many patients coming in with acute needs that were not COVID related throughout this entire time frame. And that one move allowed us to shore up our staffing in addition to the incredibly helpful members of the military that visited our hospital and are still here as a result of the Biden administration's help. But I think as we look back at this in retrospect, and this is not something that anybody expected or public health officials could even really expect, that move really helped us actually survive because having enough staff, clinical staff especially, at the bedside is absolutely important for patient care.